Extract 1. Questions 1 to 12. You hear an oncologist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Hi Mihiraa, how are you feeling today? I know you had a bit of a reaction to the last round of chemotherapy.
Hi Dr. K. Well, honestly, I'm a little shaken. It all happened so fast during the infusion.
That's completely understandable. Can you tell me exactly what happened? What kind of symptoms did you experience?
Well, it started with a bit of itching on my arms and then all of a sudden, I felt really flushed. My chest got tight, and I had trouble breathing. It was terrifying.
Okay, that sounds like a serious allergic reaction. Did the nurses attend to you right away?
Yes, they were amazing. They stopped the infusion and gave me some medication, and thankfully, the symptoms subsided quite quickly.
Okay, and Mihiraa, are you still experiencing any of those symptoms now?
The rash has mostly gone away, but I do feel a bit tired and lightheaded sometimes.
I'm glad to hear it.
I'm also worried about my foot ulcer. It seems to be getting bigger.
An ulcer, you say? That's something new. Can you tell me more about it?
It started as a small blister a few days ago, but it's gotten quite red and painful. I'm worried it might be infected.
It's possible the allergic reaction, or the chemotherapy itself, could have compromised your immune system, making you more susceptible to infection.
That makes sense.
Now, have you experienced any other allergic reactions in the past, to medications or anything else, Mihiraa?
No, never. This is the first time anything like this has happened. I don't understand why this would suddenly develop.
Well, allergies can sometimes appear out of the blue, especially with medications like chemotherapy drugs, or even medications you've taken previously without issue. It's possible your body has developed a sensitivity to one of the components. Let's run some further tests, to see if we can identify the specific drug that caused the reaction. In the meantime, we'll need to adjust your treatment plan.
What does that mean? Will I still be able to get chemotherapy?
Yes, Mihiraa, you will. We might need to switch to a different chemotherapy drug. We'll perform a test to see if you're allergic to a medication called docetaxel.
Alright. Is that as effective as the last one?
It has a similar efficacy rate, but of course, there's always a chance it might not suit you either. We might also consider immunotherapy.
Okay, I've heard about that. What does it involve?
Mihiraa, it has emerged as a significant advancement in the treatment of cancer. It works by harnessing the body's immune system to recognize and attack cancer cells more effectively. We can discuss the details further once we have the test results.
Okay, that sounds good. But what about now? How will we proceed with treatment in the meantime?
Mihiraa, we can try delivering the next round of chemotherapy at a slower rate. This might lessen the chance of another allergic reaction. We'll call it a low-dose infusion.
A slower infusion, huh? Will that still be effective?
It might be slightly less effective, but it's important to prioritize your safety. We'll closely monitor your response throughout the procedure.
Alright, that makes sense. When will I be back for my next appointment?
Let's schedule you for a follow-up appointment in 2 weeks. By then, we'll have the test results and can discuss the next steps in more detail.
Extract 2. Questions 13 to 24. You hear a dentist talking to a patient called Mihiraa. You now have 30 seconds to look at the notes.
Good morning, Mihiraa. Please, come in and have a seat. So, what brings you to the dentist today?
Hi, Darren. Thanks for seeing me so quickly. The truth is, I've been having this awful toothache on my right side for a few days now.
I see. Can you tell me a little more about the pain? Is it sharp, dull, throbbing?
It's a sharp pain, especially when I bite down on something hard. It comes and goes, but it's getting worse. Sometimes, it even radiates up to my cheek.
Okay. And when did this pain first start?
Well, I can't pinpoint the exact moment, but it must have been sometime over the weekend.
It's okay, Mihiraa. Anything else would you like to add?
Yes, I remember having some sensitivity to cold drinks, a day or two before the pain started.
Interesting. Now, have you had any recent dental work done on that side of your mouth? Fillings, crowns, anything?
No, nothing recent. Actually, I haven't been to the dentist in a few years, I'm afraid to admit.
That's all right, Mihiraa. Have you tried anything to relieve the pain so far? Over-the-counter pain medication, perhaps?
Yes, I've been taking ibuprofen, but it only provides temporary relief.
Right. Well, based on your description, the radiating pain suggests there could be an infection in the tooth or the gum tissue.
An infection? Oh dear, that sounds serious.
Don't worry, Mihiraa, it's quite common. To confirm and determine the best course of action, I'll need to take a closer look. Let me examine your teeth.
Okay, sure.
I see some swelling around the gum line on your upper right first molar. There's also a small cavity on the chewing surface of that tooth. These findings support my initial suspicion of an infected tooth.
So, what can be done?
There are a couple of options. The most likely scenario is that we can treat this with a root canal.
I've heard that can be a bit uncomfortable.
It's true, Mihiraa, that it can be uncomfortable, but modern techniques and anesthesia minimize the discomfort significantly.
What does it involve?
This involves removing the infected pulp from the inside of the tooth, and then placing a filling.
Is there another option besides this?
In some cases, if the infection isn't too severe, we could try antibiotics and a filling, but depending on the extent of the cavity. Ultimately, the choice is yours, Mihiraa. However, I highly recommend treating this infection as soon as possible to prevent further complications.
Okay, I understand. I'd like to discuss this with my husband before making a decision. Would it be all right if I call you back to schedule an appointment, depending on what we decide?
Absolutely, Mihiraa. Please don't hesitate to call us back. In the meantime, you can proceed with the over-the-counter pain medication for pain relief.
Thank you so much, Darren.
That is the end of Part A. Now check the answers.